at the KOTA Now desk, actually in studio now. I've kind of changed from my usual kind of attire, which is more of the suit stuff. I just kind of wanted to get a little bit comfy, get a little bit more homey with the whole first sip, and got my water, not coffee this morning. I already drank my 2 cups of coffee. Usually have that going. I usually drink 2 cups of coffee before I start my day. I don't know about you, Kate.
Yeah, two is my max as well. Otherwise, I feel almost like I get a little bit jittery, and we talked about that on First Sip before, kind of how caffeine can affect you throughout your day, especially when you're drinking too much or you're drinking it too late in the day. It can cause some health issues, which kind of gets us right into one of our first topics here, which is South Dakota adults having the highest percentage of medical debt in the nation. 18% of adults in the U.S. have medical debt. Do you know anyone who kind of struggles with this?
I know that at one point my mom had medical debt from me because I had to get knee surgery at some point for my meniscus. So we were struggling with that for a little bit, not anymore, but I know a lot of people are struggling. Some people, at least that I know, I want to say I do know like 1 or 2. Yeah.
Yeah, it kind of,
yeah,
I mean, even if it's not like copious amounts of medical debt, you know, any sort of medical debt can kind of impact a person, because it's definitely kind of a personal basis and a person-to-person basis. You know, it definitely depends on your insurance, kind of the pre-existing health issues that you might have. Now, this data that we're looking at here was analyzed between 2019 to 2021 by an organization called KFF. They kind of gathered this information to get the data that says South Dakota has the highest percentage of medical debt, including the contributing factors to our high rates of medical debt, which include our high rates of poverty and healthcare expenses. South Dakota ranks second in the nation for medical costs.
Especially, that's shocking, first of all, especially with, you know, a lot of the field around here is very much like hands-on, you know, a lot of workers that work in construction, ranchers and stuff like that, which is very hard to do and can sometimes cause serious injuries. And to know those stats, it's kind of, it's eye-opening.
Right, and rural access to hospitals. Actually, a new study came out today talking about rural workers' access to hospitals. The drive time has gone up from an average of 47 minutes to 55 minutes. So that is also playing a factor in our healthcare expenses, because ambulance rides cost a lot of money, and even if you have to use your own gas, that costs a lot of money too. Just maybe going to and from the hospital for regular checkups and appointments. An increase of over $2,000 from 2022 to now is what kind of has caused the increase. It was around $1,000 was the average medical debt. It's now up to $3,100 for the average amount of medical debt that someone might have. So there are things kind of being introduced in our legislature to kind of help people out, but you know, it's not looking good for those bills. So this is something that is kind of plaguing South Dakotans. For sure.
I mean, hopefully some of the stuff that, you know, the South Dakota legislature has proposed kind of alleviates those worries and those kinds of issues for a lot of South Dakotans, because it is one serious thing. It's also not cheap.
Yeah.
It is very expensive to kind of, if you do go into medical debt, it's very expensive most of the time.
Yeah. So some things to look out for. You can go through your credit agency. If you have Equifax, Experian, or TransUnion, you can voluntarily get at least $500 removed from your credit report. And some other bills floating through the legislature right now are completely erasing medical debt from your credit report. So hopefully we see some progress with that in the next couple of years, but neither of the bills in the South Dakota legislature passed this year.
Well, so. That's unfortunate to hear.
Yeah, not great, but you know, there are a ton of contributing factors when it comes to medical debt, so hopefully people can
kind of get that go working, or kind of propose something new in the future and get something going with that, because that is an important issue that a lot of our viewers are worried about and a lot of people are worried about nationwide. And you know, kind of from medical debt to a little bit a less heavier note. Let's talk about kind of phone alarms. Do you use a phone alarm in the morning?
I do, every single morning. I have 2 that wake me up, and if I miss the second one, you won't see me here. So I got to make sure that I get up after that one.
But you have 2 though, right? Not more than 2?
Not more than 2.
Okay, well that's good, because according to various studies that have been done, kind of showing that actually phone alarms aren't ideal. You should probably not be using your phone to wake you up in the morning, especially if you're one of those people that kind of sets up more than just 2 or 1 alarms to kind of wake you up. According to this kind of study that I was looking at last week, February 21st, you know, for many people, phones have replaced alarm clocks, which again, like I said, might not be the smartest move. Reasons being, it's easy to click that snooze button. You know, your alarm goes off, it's right there, the snooze button. There's like no pushback, no button that you have to like forcibly press down.
Yeah,
it's
and
just
you know, most people sleep with it right next to their bed, so it's not like
Yes.
they have to get up and turn it off or
not
move
at
across the
all.
room or anything. Yep.
And it's easy, and at night when you're going to bed, when you're setting up those alarms, it's easy to kind of, once you're setting up those alarms, like, oh, there's something on social media. I got a text message. I got a messenger message. I got something. It's easy to kind of doom scroll. It's easy to kind of get back into the habit of making your brain work at night, kind of using that phone, which at night it should be kind of, you know, you put the phone away, you have your alarms preset, put that away, kind of let your brain start to get sleepy, get rested, and you know, sleep procrastination, that's another big thing, which is it kind of encourages you not to go to bed on time if you are one of those people that kind of struggles to get up in the morning. You know, this morning snooze is an issue for the reason being that, you know, if you do end up hitting that button once, it can kind of help you, you know, for some people it helps them wake up. If not, it kind of helps it not wake up, in the sense that the study was saying, it was saying that once you hit that morning snooze button, it kind of starts to affect the way that your brain begins to function in the mornings. So if you go back to sleep, you're not getting that healthy sleep that you're supposed to be getting.
Yeah, that 5 more minutes
Yes.
essentially doesn't actually give you any more minutes of extra sleep. It's like you're allowing yourself to almost get back to sleep, but then you're interrupted again and again and again, which yes, makes you sleepier throughout the day and kind of encourages an unhealthy sleep pattern, especially in the morning. And it almost seems like it would be better to set the alarm when you would typically set your last alarm, because if you're wanting to get that amount of sleep, but if that again would cause you to be later, make things kind of last minute, that would also kind of cause an issue for you in the morning.
Yes, and it does affect the way you start your day, especially because if you've ever hit that snooze button, you become groggy, and it's just not fun for anybody. But some tips here, like you said a little bit, it says setting the alarm closer to when you need to wake up, kind of going to bed earlier. Shocker, right?
Yeah, I know, big one.
And then using an actual alarm clock, kind of replacing that phone for an actual alarm clock, putting the phone somewhere else, maybe in the kitchen while you have the alarm clock in your bedroom to kind of wake you up. Again, some best ways to get good quality sleep is to get bright light, get that bright light in the daytime. If you do if you do wake up during the time when the sun starts to rise, maybe getting used to that sunrise hitting your face, opening up that window or something, or that blind or that kind of curtain, get that sunlight into your room. Exercise for at least 30 minutes 5 days a week. That's also been shown to kind of help you get that good quality sleep. Avoid heavy meals, avoid nicotine. That is a crucial one, since it is shown that nicotine kind of does disrupt that sleep pattern and makes you kind of not want to feel sleepy at night. And also eat meals at a consistent time. This one was weird. I wasn't expecting, you know, the kind of consistent time to eat meals was going to be a big factor, but it is true, you know, for some people it's harder to sleep on a heavy stomach. So like if you just got to eat a meal, it's kind of harder to fall asleep. For some other people it's easier. But kind of doing that also helps your body rest up and not have that full meal and continuously working through something heavy.
And if you're someone like me who does kind of need something to wind down while you're in bed, reading a good book can help a little bit. I've started to kind of reduce my screen time throughout the day. So something I've kind of gotten accustomed to is reading a little bit more throughout the day. At night, it does make me a little bit sleepier, and it does kind of help you fall asleep a little bit.
I agree with you on that, Kate, because I was going to say, I just started, like not just started, but a couple months back, I want to say November 2024, I started just picking up a book instead of having to just force myself to just lay it in the dark. I picked up a book, read an hour before I go to bed, done.
Yep, and that makes it nice and easy. Hopefully the book isn't too action-packed, otherwise it might keep you up a little bit later. But you know, you can always, the good thing about your book is you always pick up where you left off versus, you know, social media. It refreshes, kind of takes you away, takes you out of that moment, so it can be a little bit harder to put your phone down versus a book that'll always be there. But,
Exactly.
you know, speaking of books, we're talking a little bit about teacher pay as well today. South Dakota ranks 49th in the country for how much they pay their teachers, with the lowest earners being around $45,000, the highest being just above $71,000, which isn't great in comparison. Obviously, we're 49th. You know, your location in South Dakota can vary this. Eagle Butte pays their teachers the highest, but Mobridge is paying the lowest. Oh. So, you know, Rapid City, we kind of sit right in between there, especially in Pennington County. It's usually around $53,000 for your average teacher, which still ranks us obviously very low in the country for teacher pay. Some other factors that kind of affect this are your experience. Obviously, if you're a teacher with more experience, you're going to be paid more. If you have higher skills, you're going to be paid more. But, you know, it kind of all depends, especially where you are. One thing that makes South Dakota sit at the lowest, at one of the lowest spots in the country, is the fact that our salaries have not been adjusted for inflation in recent years, since 2017, actually. So that $45,000 low ball has been the same since 2017, which means, you know, that $45,000 that went a long way in 2017, it's not going that same distance today. So it causes kind of a big issue for not only, you know, inner city teachers, but also our rural areas, getting teachers out there. It makes it harder and harder, especially we also have a teacher shortage here in South Dakota. So all of these factors are playing into that as well.
No, exactly. You know, it's very interesting to say that, because it is kind of a shocker when you hear those numbers, especially for such a crucial field of education. And it's kind of cool to think. It's kind of cool, but it's also sad to think, because there's stuff advancing to help these teachers kind of be more efficient in their classroom, whether it's using AI in the classroom or kind of being a little bit more hands-on learning with their students and whatnot, kind of being there, trying to avoid any of that social media stuff right now, avoiding technology, stuff like that in the classroom. But it seems like even though that is happening, it's a necessity, and it needs to kind of start going up a little bit more, especially with the times.
Yeah, that's right. Well, some good news is starting July 1st, 2026, so about a year and a half from now, South Dakota Public Schools must pay their teachers a state minimum salary, which is currently that $45,000, but they do plan to go up each year with state funding increases. Hopefully, we will see those the Department of Education funding increases in the future. But for now, South Dakota teachers do have a little bit of a light at the end of the tunnel with those inflation increases coming, those inflation adjustments. You just got to wait about a year and a half, it seems. So.
Yeah, no, and that's good though. I mean, at least we're working our way toward something better.
That's right. Yeah, slowly but surely,
Yes.
of course, how everything goes around here.
But you know, kind of talk about slowly but surely, right? Something that kind of wants to kind of slow down is your brain during the day, especially after a hard day's work. You kind of want to nap. If you're thinking of napping after work today, you should probably avoid doing so. Or there's studies that say that sometimes maybe a 5 to 15 minute nap can definitely help. But according to another study by this time it was published in the General Psychiatry Journal, adults ages 60 and older who took afternoon naps showed signs of better mental agility compared to those who didn't. Again, like I said, there's a precursor there. It is 5 to 15 minute naps. We're not talking about hour-long naps. In fact, if you sleep a little too long, it's actually shown to have bad effects. In fact, it's supposed to, according to the Alzheimer's and Dementia, the Journal of Alzheimer's Association, if napping is done once a day for more than an hour, elderly adults are 40% more likely to develop Alzheimer's than those who do not nap for more than an hour.
Yeah, and that's a staggering number, especially when you're looking at all this new research that's coming out about Alzheimer's and everything that kind of impacts that in your early life to where we are now with people who are already kind of being affected by that, and kind of how you can't reverse it. That's some good advice to know for, you know, even people our age, middle-aged people, kind of to watch your sleep habits, especially during the day. You know, again, going back to the alarm clock, if you're noticing that you're needing to have more than an hour-long or 15-minute long nap during the day, maybe kind of adjusting when you go to sleep, how you're waking up, how many times you're hitting snooze. All of those things are obviously affecting you, not just now, but well into your old age as well.
And actually, funny that you said that, because The AHA journals say that if you are not getting that good quality sleep, you should just avoid naps altogether and fix your sleep schedule so that way maybe you aren't feeling a little bit sleepy during the day. I know that I used to be a big nap taker during college because after class I'd be like, there's nothing more to do except take a small 30-minute nap before my next class.
Right.
And then I got out of that habit once I graduated. But now there's actual, studies that are kind of taking a look at these habits and whether or not it is, whether or not you do it. It's that same concept, especially with food, is to moderate yourself whatever you do. In moderation, it seems to be that it works fairly good for you. But if you overindulge or have an excess of that, it kind of has the opposite effect.
That's right.
Which is kind of interesting. It's good to know, especially if you're a big nap taker, that maybe switching that schedule up could help you in the long run.
That's right. Well, I'm going to need to take some of this advice because I do enjoy myself a nap after work here and there. So
hey, at least as long as it's not every day, you should be fine. It's not 5 days a week. You should be a-okay. I know I take a nap every once in a while here, so I don't blame you.
They're definitely needed on occasion. But,
yes, especially if it's a stressful day.
Everything in moderation, of course. So thank you for joining us this morning on First Sip. Make sure to join us tomorrow. We'll cover some more topics. Do you have any good news coming up?
Yeah, no. So actually, be sure to first of all, be sure to tune in to KOTA Now tomorrow for your midweek weather update. Again, getting your latest weather update, kind of helping you prepare for that second half of the week. And be sure to tune in on Thursday for our 7th episode of First Sip on KOTA Now. And then Friday, funny enough, we started a new segment last Friday with Mimi Herrick, DIY Fridays. So be sure to tune in then as well for DIY Fridays and your, again, weekend weather outlook, helping you stay prepared for that weekend ahead. But for now, I'm Humberto Giles Sanchez.
And I'm Kate Robinson. Have a good day.